Hello, I'm Jennifer Ben Brahim, and welcome to the 51%, a show about women reshaping our world. Coming up. More than 2 cases of sexual violence are reported each day in French hospitals against female nursing staff, this according to a new report. And midwives in Kenya are pushing pedal to the metal to deal with the country's mortality crisis, using 2 wheels to transport pregnant women in the most rural regions. And in India, witch hunting is still ever present, targeting single, widowed or socially isolated women. Many suffer extreme psychological trauma and violence, including sexual abuse. Starting here in France, where nearly 1 in 2 nurses have reported experiencing sexual violence at work. This according to a new study by the country's Nursing Council. In 2025, more than 2 cases were reported each day. But despite this, reporting rates are extremely low. From this year, a simplified alert system will be available for victims. Our colleagues at France 2 bring us this report.
Emily M. left the hospital system long ago, but remembers clear as day the sexist hellscape in which she started out as a nurse.
You feel like a piece of meat in white scrubs. Comments on my chest, my bottom, my smile, the size of my mouth. Wandering hands sometimes stroking you on the shoulder. For me, that wasn't trivial.
These memories are nearly 10 years old now, but new figures show that nearly 50% of nurses still have similar stories to tell, be it at the hands of patients or colleagues. More than 900 cases of sexual harassment or assault against nurses were declared last year. That's more than 2 per day.
If anyone at the time had told me to file a complaint or go on the record, or even just flag it to my superiors, I would have done so.
The report shows that 40% of victims made no formal complaint. But a new system hopes to simplify the process, and those responsible face sanctions from €7,500 fines to several years jail time.
To Kenya, where women are racing against time, quite literally, to save mothers' lives. The Boda Girls are trained nurses in rural Western Kenya, using motorcycles to rush pregnant women to medical care. A move to help tackle the country's mortality crisis. Laurent Berchecker has this report.
Cruising on the dirt roads of Kenya's Siaya County, these pink-clad bikers are known as the Boda Girls. All are seasoned motorcycle riders, but also trained nurses and health workers who roam the Kenyan countryside to make sure pregnant women get access to the care they need.
There was this time my client called me at around 6 a.m. in the morning, and upon arrival, her water was already breaking. So when I was riding her to the hospital, she was holding me too tight, making it unbearable for me to even ride that motorcycle properly. But thank God we arrived on time, and immediately upon reaching the hospital, she just delivered.
The program was launched in 2022 to tackle a growing challenge in Kenya's rural communities.
Access to transport is one of the major overlooked aspects on women's health and economic empowerment, especially in the rural areas where the distance and the cost are the barriers to access to health.
A lack of transportation combined with long distances that result in thousands of pregnancy-related deaths each year, according to UNICEF. But for many Kenyan women, the Boda Girls initiative, which is completely free of charge, has begun to bridge that gap.
It used to be a challenge to afford the bus fare to get to the clinic. If I couldn't make the trip, I missed my appointment and had to reschedule. But now it's become easier. I simply book an appointment with a Boda girl who calls me on the day I need to go to the clinic.
An initiative that could be the difference between life and death. Workers at the Matibabu clinic say they've experienced a 67% increase in hospital deliveries since the launch of the program.
And finally, witch hunting is not a relic of India's past. It is a brutal reality still haunting villages today. The targets are most often women, single, widowed, or socially isolated by their communities. Many suffer extreme psychological trauma and violence, including sexual abuse. Despite laws being passed in several states to stop the practice, the threat persists. And figures from the National Crime Records Bureau show that more than 2,500 women have been killed over alleged witchcraft over the last 25 years. Kansa Juned and Lisa Gamonet report.
In Misarna, a village in the eastern Indian state of Jharkhand, Lalita Devi is still mourning the loss of her mother Kamli Devi. A month ago, she was beheaded by villagers after being accused of using black magic to cause the suicide of a young man.
This is my mother.
Kamli Devi had already been branded a witch 14 years ago after the untimely death of a newborn in the village, with police intervention at that time preventing any harm. She was routinely blamed for bringing misfortune to her neighbors.
8 men dragged her from the home and beheaded her. They threw her head elsewhere and dumped her body in a bag in a mine. We found her body 5 days later. We know our mother was not a witch. People here are suspicious. Whenever someone died, they said that she had killed them. If someone fell ill, they blamed her. I want everyone who dragged my mother away and beheaded her to be charged. When they will be punished, then my mother's soul will be at peace.
2 accused have been arrested so far, 8 have fled. According to the National Crime Records Bureau, Jharkhand recorded 22 witch hunting related murders in 2023, the highest in India. About 78% of the state's population lives in rural areas with limited access to healthcare. Symptoms such as unexplained illnesses or misfortunes are often seen as signs of witchcraft by villagers. To cure themselves, people turn to local healers known as ojhas, who are believed to have the power to counter black magic. One such healer, Najir Bhokta, has been practicing for 60 years. 14-year-old Pinky had been complaining of having nightmares, so her mother brought her to see this healer for treatment.
After seeing this girl, I suspect witchcraft. Let me be very clear with you. There are various issues which the doctor can treat. But for things like witchcraft, the doctors cannot do anything. With my devotion and blessing from the Lord, I have the power to heal. If I treat someone for 3 evenings, they will become healthy.
He charges around 10 euros, a high sum, which he says people willingly pay for his cures, although they have no scientific basis.
Through faith healing and medicinal herbs, people get healed. When children become ill, we often rely on healers who practice occult rituals and seek treatment from them.
Many trust him deeply, claiming that his treatments have always cured their ailments. In villages where belief in the supernatural runs deep, this NGO turns to street plays, a mix of song, drama and dance to raise awareness. But performing street plays comes with its own risk. The NGO frequently faces resistance from villagers.
There are many villages where we're not allowed to enter. They say, you cannot perform these plays here. When we try to reach the victim, we are stopped. They do not want us to take the issue to higher authorities because they fear it will become a bigger issue then. If that happens, many people may support the victim and act on it, and the village would get a bad name.
Beyond awareness, the NGO also works directly with survivors. Those who have been branded witches and ostracized. Today, some victims have gathered here to share their experiences.
There was an elderly man in the village. He died due to old age. After his death, in a village meeting, they accused me of eating him. I was isolated from the village.
A neighbor said that if I could kill my husband, I could kill theirs too. Even today, they taunt me. But I don't take it to heart because I know I'm not a witch. I ask them, where is it written? Show me the proof I'm a witch.
The NGO has welcomed 76 victims since it began 1 year ago.
Through counselling, we assess what support they need, whether medical care, enrolment in government programs, or opportunities such as sports. When the victims leave, they have a smile on their faces, and that is when we feel our efforts have paid off.
For many women, the trauma lasts long after the violence ends. Govind Kelkar from the Indian Rationalist Association says, witch hunting is a sign of deeper gender and social inequalities.
This practice, which is so rampant, it is actually femicide, a kind of femicide, and of poor women, of supportless women, of women who cannot go to the court. Local level bureaucracy is so partial to these women that as if they do not exist. Idea is to integrate them within the society, but at the same time treat them as normal human beings.
Despite laws against witch hunting and black magic in 8 Indian states, a government report released last September recorded 74 witch hunting related murders in 2023.
And that's it for this edition. So until our next show, bye for now.